why just having your mole whipped off by your local beautician, why is that not okay?
The major peril of this is that, like skin cancers have got signs, and what are like a tip of the iceberg. Once you remove the tip of the iceberg, you miss the boat to identify what actually lurks underneath, which can go down to affect the lifespan, and it could never be diagnosed, and leaving no trace.
So if that mole was actually a melanoma, it was a cancerous lesion, just sort of whipping off the surface, you've left cancer still underneath that you may not even be able to see, which may spread, and that's bad news.
Potentially.
Are you seeing this in practice?
Oh yes, very often though. Sometimes that you can see on YouTube video just propagated, or on the social media, saying how people just shave off the tip of the pigmented lesion because of an annoying, ugly looking mole.
Do it yourself at home.
Pretty much, that's an extreme example, yes.
So I know certainly that more and more beauticians and aestheticians who perhaps do some toxin, do some filler, have a laser and might decide they're going to whip off a little crusty looking lesion on that shoulder or on the forehead.
Yeah.
You're saying what you really need is you need a proper diagnosis. You need someone who is qualified to be able to diagnose what exactly that lesion is and remove it in the correct way.
Exactly.
Yeah?
Yes.
And have you seen actual examples of where that hasn't been done and has had dire consequences?
Oh, all the time. The reason it's such a big problem to me is that individuals got blemishes tend to be sun worshippers mostly, and those individuals are standing higher risk of acquiring true skin cancers. And as a result, they walk into them paying for what they came in for, to make the skin, removing all the blemishes and amongst which one of them is bound to be just changing for something more sinister. But if with an unsuspecting practitioner, along with a consumer per se, this can be just wiped out, leaving behind what is actually potentially living with the person, growing, whilst the true practitioners, like the dermatologists, surgeons, who could have just removed it properly, rendering the person a cure, may have just missed it all this time before they eventually turned up with a metastatic skin cancer.
So something that's spread
everywhere.
So what would your advice to patients be then? Because it's not just dermatologists that do aesthetic procedures, cosmesis, is it? But not everyone is going to be able to go and see a consultant dermatologist, for instance, for their toxin. So what should patients do? Because not everyone is going to see a consultant dermatologist for their cosmesis. What would you advise them?
Now, I would advise basically choosing practitioners registered on Safe Face, who's got regulatory bodies who have been time tested, such as the General Medical Council for the doctors, and those individuals would be made accountable for their actions, and therefore they also work according to the national guidance for what's best for patient when it terms of diagnosis skin cancers before actually putting their hands on to deal with the cosmetic concerns.